All right, good morning, everybody. I hope I'm audible and I hope everybody can see me. Good morning, good morning, good morning, everybody. Thank you for joining us. Thank you for honoring us. You're welcome to the December edition of our Providers Forum. As usual, of course, when you come in, it is very expected that you maintain quietness. And of course, our IT team will be dropping the provider survey so that you can kickstart things and get right into it. But I sincerely wish to really welcome us for honoring us with your visits. I can see that more providers are joining. And of course, I would be iterating some of the ground rules as we go forward. So thank you so much once again for joining us, all our beautiful providers that we have partnerships with. Thank you. So I will just go straight to introducing myself. My name is Margaret Achibong. I serve as the Unit Head Provider Services and Client Services and Provider Engagement here at Philips HMO. So thank you so much for joining us. All right, so without further delay, we apologize for starting late. Of course, we had to, just wait a bit so that we can have a sizable number of people on the call before we could start. But we're going to not waste people's time any further and would go right into the event proper. All right, so just as it is in our tradition, before anything kickstarts, we like to dedicate the event to God, to the hands of God, so that He would oversee our progress. So without wasting any time, I would like to call on our Head of Quality Assurance in the person of Dr. Dolapo Orimoloye to lead us in the opening prayer. Doctor, please go ahead. Thank you.
Hi, good morning, everybody. So let us pray. In Jesus' name, our Lord and our Father, we thank you for today. We thank you for this year's Provider Forum. We give you all the glory. We give you all the honor. We give you all adoration and thanks. Please be glorified now and forevermore in Jesus' name. We thank you for 2024 so far, for the ability to do business. We thank you for life and we thank you for sustenance. Please be glorified forevermore in Jesus' name. We commit this year's Provider Forum into your hands and we declare it open in the name of God the Father, in the name of God the Son, and in the name of God the Holy Spirit. Everything will go well and there will be a smooth running of the forum in Jesus' name. We thank you for answered prayers, for it's in Jesus' mighty name we have prayed. Amen. Amen.
Amen. Thank you so much, Dr. Dolapo. All right, the national anthem, please. All right, thank you so much for that. Thank you everyone for sticking around. Welcome once again. I can see that there are still more providers joining us. Thank you, thank you, thank you. I'll just go through the ground rules again. Please, once you come in, of course, ensure that there's quietness. And our provider, our IT team rather, would be posting the provider survey so that you can participate in that as soon as you come in. Of course, once you take part in the survey, please remember to drop your phone numbers alongside the correct operator being whether MTN, Airtel, Glo, or 9 Mobile, so that you can receive your data bonus. Of course, it's already displayed on the screen, so please take note of these things. If you have any questions, if you have any comments, please go ahead and drop them in the chat box. We have a team who is going to be responding to any questions you have via the chat box. And if there are any questions that we cannot respond to via chat, we would ensure that we respond to you when we get to the Q&A session. So please note that we would ensure that all questions, all concerns are addressed in this meeting. All right, thank you so much. So without wasting any further time, we would go straight into the introduction of the PHMO members that we have on this call, some of our key members that we believe you should take note of, which will be displayed on the screen shortly. I wouldn't really bother to go into all of that because they're going to be displayed so you get to see. And I'm sure a lot of you are already familiar with us. But of course, for the purpose of this call, it is very important that we keep familiarizing ourselves with the members on the team. All right. Thank you so much for that, IT team. I'm sure we can, we've familiarized ourselves with some of the people that run things here at Philips HMO. All right. So next up, we will be having the opening remarks from our MD CEO in the person of Dr. Victor Benebo. MD, please go ahead and give your opening remarks. Thank you.
All right. Apologies, sincere apologies. I didn't realize I was muted. So I'm just going to take over what I was saying before. So I was welcoming everyone to this meeting, both the team of PHMO and also very importantly, our providers, our partners. We want to thank you for having this time together with us in this very important session. It's something we do regularly to touch base with our providers because we are committed to engagement and improvement in what we do with our critical stakeholders. And we want to say thank you for sparing time to be in this meeting. We trust that at the end of this meeting, you will also do us that favor in filling out the survey form just for us to have feedback, and then of course to also be able to indicate your line and what is it that the network you use, so that we'll be able to send across the little data we promise just to support this meeting. Once again, I want to say that we are very grateful to God and for every one of you that has spent time to be in this meeting. We trust that will be a very productive time of engagement, and we are confident that at the end of the day, we will not have wasted our time. Thank you so much, and we wish you a very wonderful session. Thank you, and you're welcome.
All right, thank you so much, MD, for that opening remarks. Thank you so much. I'm sure we are now sport to go into the event proper. Without further ado, we will go straight into who we are as Philips HMO, to give you some of the brief details of how we have come to be, what our partnerships are like with, our providers, just typically basic information that we think you need as a provider to do, to have, proper business with us. So we would like to introduce our head of medical operations, in the person of Dr. Eku Ezechinyere, who will take us on this session. Doc, please go ahead. Thank you so much.
Good morning, everyone. Once again, it's quite a huge pleasure to have us all gather this morning. And even though my MD has done that, let me also use this platform as an opportunity to thank you all, for the partnership. Like the popular saying goes, that it takes two to tango. So we really appreciate your input. That is our providers, and the fact that sometimes you even have to bend over backwards to make sure that this relationship works. So we are quite grateful, and that is one of the reasons why we're putting this forum together, because sometimes we don't really have that opportunity to extend our gratitude to you. And while telling you who we are, what I'll be stressing would also be our pain points, because we know that conflict never helps any partnership. So I'll be discussing and trying to make sure we get to know the areas that usually cause a lot of conflicts, so that going forward, especially in the new year, those will be reduced to the barest minimum. So, Mr. Tommy, please, could you start sharing my slides? Thank you. So, who we are, we're Philips HMO once again, and a company incorporated in Nigeria to provide prepaid, comprehensive, qualitative, and affordable healthcare services and solutions through a network of effective and efficient healthcare providers. And that is you guys, effective and efficient. And our healthcare plans are tailored to meet the specific needs of individuals, families, and corporate entities. So our vision is to make healthcare available to and for everyone. And our mission is to deliver healthcare that works for our enrollees. And for that to work, that means our partnership with our healthcare providers also have to work. We are nationally accredited by the Nigerian Health Insurance Scheme, NHIA. And what are our core values? Customer focus, reliability, responsiveness, ethics, and tenacity. So one of the pain points is usually eligibility. And we've noticed that a number of times this also leads to enrollees having, a protracted stay in the hospital without their issues being resolved. So I'll be taking us through how to confirm eligibility, especially for our new providers. Some providers have been with us for a while, but there are also some providers that are quite new on this scheme. So I think those are the major ones that this will be speaking to. So online eligibility check is compulsory for all enrollees. And why is this compulsory? Because sometimes some enrollees premium cover might have been exhausted and they will still come to the hospital for care. So it is through the online eligibility check that you'll be able to confirm whether they are still eligible to access care or not. And verification is usually via the portal. And I'm sure all providers here should have been trained about how to make use of MediCloud, which is the portal we use. And none of our enrollees should wait for more than 10 minutes for eligibility check. And in the event that you cannot confirm our enrollees' eligibility, then please contact our call center via these following channels. So we notice that a lot of times some providers call the wrong numbers and some send mails to the wrong email addresses. So our 24-hour call center is 02016339123. I'm going to reiterate that 0201-633-9123. This is the number through which you can get us. Then our dedicated HCP email address, hcp@phillipshmo.net. Please notice that the Phillips is a double L and not a single L. There's a particular provider. Every time, even though we've gone through this over and over again, you keep using a single L. And what happens is that we don't get the email. And that means that the enrollees get agitated. And when they get agitated, it affects our brand and it also affects yours. So please, it is hcp@phillipshmo.net. And Phillips, double L. Also, some providers have a penchant of sending the email address to our info address. Our info address, some does not address these issues. And what happens is that even though we get it, but sometimes before we get it, time would have gone. So this is the hotline and this is the hot email address, hcp@phillipshmo.net. Thank you. So like I said, access to care is obtained on successful eligibility check. Referral for secondary care must be from a primary care provider or by pre-authorization by Phillips HMO. So it's either you refer the client to a secondary provider or you send us a mail, we will now refer the client on your behalf. Primary care services should be attended to at first by the general practitioner and not by a consultant. All specialist care requires pre-authorization except in emergency cases. In emergency cases, of course, the priority is to save the life and not waiting for a pre-authorization. Admission requires notification within 24 hours. Mr. Tommy, please. Next slide. Next slide, please. So for prioritization, requests are usually made through the portal, and the system will generate automatically an authorization code that will be sent to your email. And like I said, our hotline 02016339123. This is our dedicated E1 line with multiple channels that go straight to our 24-hour call center. And email address, once again, hcp@philipshmo.net. Next slide, please. So before rendering the service, make sure that you get the PA code. And if PA codes are not issued within 15 minutes, please put a call through to our call center. In medical emergencies, go ahead to treat the enrollee and notify us within a 24-hour period. Next slide, please. So claims, and let me mention, let me say this. One of our core values, we mentioned, I mentioned ethics. So we're actually quite big on ethics. And if we're big on ethics, that means we do not want to short pay any provider. We are not that kind of HMO that we already have a system in place that as you are sending your claims, we want to make sure you don't get everything. No. You know, a bank says a happy customer, happy bank. We also know that happy provider, happy HMO. But there are some rules that will help us, you know, when it comes to you getting your claims and getting it the way you want it and getting it as at, you know, as at when due. So one, claims are submitted only through the portal. Some HMOs send claims through hard copies. When you send it through hard copies, it takes us time to upload, then vet. So basically, it truncates the system. So for things to work, we are imploring that you only submit your claims through the portal. What that does is that it comes directly onto our online platform, and it quickens the process. It makes the process faster, and that also means that you get your claims faster. Next slide, please. So it is required that dental and optical centers and other specialist centers get authorization codes before they attend to the enrollee. Polypharmacy is medically inappropriate and will not be accepted. So sometimes we see this often where a client, and of course, we know you are the one seeing the patients, but even then, there are some standard procedures, some standard rules that should be followed. So sometimes we find cases where maybe an enrollee is supposed to get 3-4 drugs, and a provider is supplying the enrollee with like 10 drugs. So that's not going to work. And that is also why if you send those claims, you might not get all the claims you send, because in such cases, we're not going to honor your requests. You know, we're going to vet it as according to standard and global medical standards. Drugs and investigations irrelevant by standard practice to the diagnosis and management will not be paid for. So we notice that sometimes some providers have made this their modus operandi to make patients go through management, examinations, and sometimes procedures that are not required. So in such cases, we are going to clamp down and we're not going to pay. So please always make sure that the drugs and investigations that the patients are subjected to are relevant to the diagnosis and management. Referrals for specialist consultations should be only when medically indicated, only when medically indicated, and providers should properly submit all claims within 10 days from the successful month of encounter. No Philips HMO enrollee should be denied care without contacting and getting clearance from us. So don't just take the matter into your hands. Always make sure you're working in tandem with us. Contact us and get clearance from us before you reject management to any enrollee. Next slide, please. All medications prescribed must be safe and NAFDAC approved. In line with standard practice, all Philips HMO enrollees should be duly informed of their diagnosis, treatment modalities, and management. Yes, the enrollee has a right to know what is being done for him or her. All Philips HMO members that present to the hospital emergency should be treated. All treatment should be in line. And you find out that we are reiterating this because we also know that you are quite busy and we are also busy. Sometimes when these things are not done the way they are supposed to, it leads to reconciliation. And when it leads to reconciliation, that means you have to take out time from your own normal day-to-day processes, and we have to take out time, and that drags everybody back. So we want it to be that as we are getting your claims, we vet it, and everybody's on the same page. You are happy, we are happy. So no Philips HMO enrollee should be discriminated against based on status, religion, sex, race, age, or appearance. Next slide, please. So once more, this is our email address, and you can screenshot this and maybe disseminate it amongst your staff. This is our email address, our telephone number, and our social media handles: Instagram, Twitter, Facebook, and LinkedIn. Next slide, please. Thank you. Thank you once again. And of course, if you have questions, we have a chat room where you can, send in your chat. And of course, after the whole exercise, there will also be room for questions. So thank you once again for the wonderful job we are doing. We are quite privileged to have the partnership we have with you. Thank you and have a wonderful time. Stop.
All right. Thank you so much, Dr. Izzy, for that wonderful presentation. I'm sure a lot of people have benefited, especially our new providers have benefited from that presentation. And like he rightly said, if there are any questions, just so you don't forget, you can, start putting it down in the chat box, of course. And we have people who are currently responding to questions. They would ensure that all your questions, all your concerns are responded to. And if there are any other questions, outside the chat box, there's also the Q&A session, which will come up after all of this is over, and we would ensure that we address any concerns that you have. All right, so we are going straight into the poll section, just to break the ice. We've been talking, we've been presenting all of this time. We want to just test your knowledge a bit, know that just so we're on the same page. We just want to test your knowledge and see if we're all on the same page. Do you know certain things, how to go about doing certain things? So please, it's popping up on your chat box right now. So please go to your chat right now to ensure that you can vote. Once you vote, we'll gather the responses and move forward from there. So please, it's popping up on your chat box currently as we speak. The questions have all come up already. So what is the official email address for contacting Philips HMO? Our doctor just spoke to us extensively about which of the email addresses is correct in contacting us. So please feel free to, indicate the answers if you know the answer. All right, so we'll give it a few seconds and then move on to the next question. Thank you so much. please, this segment, you don't need to, you know, type it out in the chat box. Just click on the pop-up in the chat box. Just click on any one that you think is correct. The correct answer, just click on it and submit votes. You will see where it says submit votes. So click on the correct answer, submit votes, and it will pop out. All right. So we have another question that has come up now. What is the call center number for Philips HMO? Of course, it was displayed by the doctor in his presentation. So it's really nice that, you know, this poll section is coming up right after that presentation, just to test if we had people who were paying attention to his presentation. And of course, I'm sure a lot of us have the correct answers here. So please go ahead, vote, and you know, let us know what you think the call center number for Philips HMO is. All right. Also remember that this section is actually very important. It lets us know, you know, people or some of our providers who have some difficulty in some of those areas, so that we are able to quickly address them. These are very important areas in terms of our email addresses, in terms of the phone numbers that you can use to reach out to us. All right. So please go ahead and vote.
No.
Okay. So please, like I said, it's just on the chat box. Just go to your chat and of course, click on the correct answer and submit votes. Once you do that, you will see what the correct answer is. Of course, there's another question that has popped up. What are the operating hours for Philips HMO call center? Is it 24 hours? Is it within 8 to 5? Is it 9 to 6? So please choose the correct answer and of course, submit your vote. Just click on the correct answer. You have that circular icon there. Just click on it and click submit vote. And that's all you have to do. All right, so we can quickly wrap that up. I feel like this is the last question, you know, and I'm very grateful for those of us that participated. I'm sure we know what the correct answer is. Oh yes, 24 hours. Yes, Philips HMO call center runs for 24 hours. Thank you so much, everyone, for participating. I think we can move from here to the next segment. All right, thank you so much, everyone, for participating. I'm sure all providers on this call have participated in the survey. Thank you so much. All right, so without any breaks, we will go straight into a brief address by our head of finance in the person of Mr. Lubumi Falwa. He's the head of finance and administration here at Philips HMO, and he'll be, you know, giving us some brief details as regards payments, what we need to do at every point in time on the financial side of things. Thank you so much, sir. Please go ahead.
All right. Thank you, Margaret. Thank you so much. And good morning, our team. And of course, our value customers, clients, I mean, the service providers. We want to really appreciate your support and your business with Philips HMO. I would like to just discuss a few things, basically as it affects the value chain in terms of managing the claims and ensuring that you are satisfied as and when due, and of course, few issues that have evolved lately, which of course I believe we should bring to fore so that we can discuss some of these things, and of course, being able to provide solutions. So I would like the anchor point to please go to the next slide, please. The next slide. All right, thank you so much. A few things. Dr. Eze has told us so much about claims management. We also have some level of interactions with healthcare providers when it comes to the issue of claims, particularly in the area of ensuring that payments are made promptly. We just want to just re-emphasize what he has said, that as much as possible, let us ensure that we submit our claims promptly, because that's going to help us in reducing the turnaround time in terms of processing of your claims. I mean, if claims are submitted very late, it won't get to us. I mean, from the finance point of view, it won't get to us until it has been vetted. And at that point in time, we can begin to talk about payment. So what I'm trying to say in essence is that let's try as much as possible to ensure that we submit our claims on time. Of course, we know that internally we have our own turnaround time, policies and protocols. We'll be ensuring that to ensure stability of our system. I can assure you, whenever claims is approved and is sent forward to finance department, it should, I think I didn't emphasize this fact that within 3 days, all those claims will have been fully paid. In other words, we'll have processed them. We also ensure that it's paid, and we also send advices, payment advices to our clients. That's what we've been doing over time, and we are committed to ensure that we sustain that. We have some other issues lately, whereby we have the issues of failed or return on paid transactions. It can happen, of course, because the system itself is not, we don't have absolute control over the entire payments platform. Ours is just for us to ensure that we check, we upload appropriately, and then we send those advice to the banks. But once in a while, we do have some challenges from the bank end, whereby you discover that some of these claims are returned unpaid, be some bank glitches at the bank end. Of course, those are the things that could happen. And let me just emphasize what happened lately about GTB. Maybe some of our clients will have been probably affected, and it's a universal, or let me say it's a global issue. Around October, when they had, we were trying to midwife from their old platform to a new platform. It was a whole lot of issue, and we did all we could do to ensure that we still pay our people. But we found out that some people, one way or another, they were not paid because they claimed that they didn't get those evidence of payment. And we actually follow up with our banks. And we are even trying as much as possible to also collaborate with our account officers. So in essence, what I'm even asking for is whenever you see anything or any payment on returned or failed payment, we do everything possible to escalate to us. We'll get to know of those things. And of course, we try as much as possible to pay them promptly. But we also want support and collaboration from the finance department of the care providers, because more often than not, this has to go through what I call the interbank settlement scheme. Now, if we have evidence that the payment has been made and it has gone successfully, and we are trying to convince care providers these are the evidences, we've had issues whereby some people will say they still don't have this money. What we are expecting is that at the back end, at your end, your finance man should please liaise with your own bank with our evidences. Maybe the problem could be that the thing actually could be hanging between the clearing system. So we need your collaboration as soon as possible so that we can resolve any issue that has to do with failed or returned unpaid transactions. We are committed to ensure that at least we do that, and we do it effectively well. Also, we have noted once in a while, I think there's a little bit of an improvement now, that more of our clients, they don't even send us correct bank statements and bank account number details. Some don't even indicate, and some, for one or another, may be another error of oversight. They don't quote their bank details correctly. We want to plead again that please ensure you give us the correct bank details. There are a few clients, of course, we have escalated to the claims department. They don't even send us their bank details, and that means that it's very difficult for us to make payments. So we expect that when you are submitting your claims, one of the things that is important for you to provide is your bank account details. Without that, it might be very difficult for us to process such claims. And of course, like I said, the claim payment process is not complete until we have advised the service providers, and that's what we do regularly. Anytime we have uploaded payment and it has gone through our payment system, we, as much as possible, try to upload all the payment evidences via mail, and we send them across to our clients. In case you don't have, for any reason, please feel free. But I know from my end, it's a statutory obligation. And we owe you the obligation to ensure that at the end of every payment cycle, we send payment confirmation receipt to AirCare. But that's to assure you that your payment has been made. And if you have any issue around that, of course, that forms the basis for you to escalate onto us. And finally, just like I established at that time, we still seek your further collaboration it's very important for us to work together. For example, when you escalate an issue to us, we transfer to at the back end there to resolve them. But more often than not, also we need the support of our colleagues in the finance department so that we can talk together. They understand our language, we understand them better. So we expect that our colleagues over there, if there's any issue that has to do with payment, please escalate to us promptly, and then we can show you, of course, we will do everything possible to within 24 hours to get back to you. And if there's any issue that need to be resolved, we also quickly identify them. I think these are the things we have observed over time, and we believe that if I'm able to put some of these things in place, we are going to go a long way to ensure that we have what I call a seamless operation, system integrity, and then we go furthermore to even satisfy our clients. And that's the major reason why we are all here. At this point in time, I want to say thank you for listening, and I'm sure if you have any observations or questions, can be forwarded to us, but we are going to attend to them appropriately. Thank you so much.
All right, thank you so much, sir, for that wonderful presentation. We'll go straight into a presentation by our BD team, which would be taken by the representative of our head of BD. Our head of BD is Mr. Kolawole Adeshoga, but he will be represented by a member from his team. That would be Favor Ejogu. So please go ahead, Favor, to do the presentation. Thank you.
Thank you.
Good morning, everyone. Once again, my name is Ejogu Favor. So, on behalf of the head of business development, Mr. Kolawole Adeshoga, I'll be briefly walking us through on some of our products and services that we offer in Philips HMO. Next slide, please. So, Philips HMO is a subsidiary of outsourcing, Philips Outsourcing and Consulting, and it was established in 2019 to positively revolutionize healthcare financing and delivery in Nigeria.
But if it's not, I will send it.
So moving on, currently we have products and services that we offer to some of our clients, which are listed here, not to mention but a few. We currently have the private health insurance plans consisting of our corporates and SMEs. Philips HMO, we are very conscious about our enrollees and we try to accommodate as much as we can. That is why we have the plans like the small and medium enterprises. We have the school health plans that ranges from secondary to primary, our preschool are not left out. Tertiary institutions, we handle their health insurance programs also. We also call them TSHIP. And currently we have the social health insurance plan, which is under the NHRA, third-party health administration plans, also known as TPA. We also run medical screenings like pre-employment, food handlers tests, our preschool screening plans, and the likes. We have international health insurance and evacuation plans. We handle worksite clinic management services, community-based social health insurance program. We also have the retail products for individuals and family. Like I rightly stated, we are conscious and minded. We are people-minded also. And we have the state health insurance program. And we also customize plans to meet specific needs and wants of our enrollees within their budget also. Further on, we have other value added benefits, which comes at no extra cost. Sorry, the next slide. Thank you. We have the likes of our pharmacy benefits, which one way or the other, it's basically administration and direct supply of prescribed drugs to whatever the location our enrollees deem fit. We handle rebates on low utilization. What this basically means, we check your utilization and try as much as we can to take off a certain percentage off upon next renewal, as long as you did not exceed the stated utilization. We run fee for service. Roaming is also allowed because we are nationally accredited, so we work with hospitals providers, so to say, across any state in Nigeria. We have the periodic aerobic sessions that works hand in hand with our employee assistance program, also known as EAP. We have a medical advisory committee. Next slide, please. So these are some of the clients we have currently with us. And also we have testimonials from some of our valued enrollees. And this is some of the things they say about Philips HMO. Sorry, next slide. Next slide, please. Next slide. Sorry about that. So this is also a way to reach us from our sales team, sales departments. You can reach us through this email listed here or through direct telephone. The numbers are pasted on the screen. Next slide, please. So thank you very much for working with us, and we hope to continue having a mutually beneficial relationship with each of our providers. Thank you. Maggie.
Thank you so much, Favor, for that presentation. And you know, we as our providers can see, we have quite a number of products that cater to a lot of things that we feel our enrollees can benefit from. So please also help us spread the word in your facility. If you have someone who approaches you and says, oh, okay, they want to get a health plan, please do well to refer us to all of your private patients. Do well to refer us whenever members approach you to ask. Members of the public approach you to ask for such services. We have quite a number of products that cater to a wide range of needs of people in the general public. So thank you so much. So just to iterate, of course, the survey link is pasted in the chat box. Like I said, please go ahead and fill out the surveys. And of course, this would ensure that you get your free gifts at the end of this presentation. So please go ahead and participate in the survey. Once you're done with that survey, ensure you drop your phone number. Of course, also indicate the network provider, whether it's MTN, whether it's Glo, 9Mobile, and the likes. Indicate that so that we can go ahead and ensure that you get your gifts at the end of the day. But please do that after you have filled out the survey as it is. All right, so going straight into the next presenter, we have our head of IT and enrollment services, Mr. Tomi Ishijola, who will be taking us on data management, protection, and compliance. Data is a big thing for us in this industry. We get to deal with quite a number of enrollees, so we get to intimate our providers on how to make sure that data is protected for all of these enrollees, because you don't want, these are medical histories of people, and you want to ensure that all of this is kept as it should be. So please, Mr. Tomi, go ahead, please. Thank you.
Thank you very much. And good morning to each and every one of us on the call. It's my pleasure to take us through this session on data management and compliance. The essence of this session basically is to give some level of awareness as regards data management, and also the Nigerian Data Protection Commission's or Regulation Act that has been executed in Nigeria. So Okay, so data management and security has become a really global concern and challenge all over the world, and hence the need for organizations, individuals as well to take proactive approach to implement and ensure integrity of data and how data is also being used across the various spheres of life. Bringing it home, in effective June 2023, the Nigerian Data Protection Act was signed into law and basically provides a legal framework for the protection of personal information, and also the establishment of Nigerian Data Protection Commission as an agency of government to regulate how personal information and data is being processed, handled, and utilized. What are the key objectives of the NDP? Basically, there are quite a lot of them, but just as an extract, basically number one is to safeguard the fundamental rights and freedom of data subjects. I'll touch on what data subject means shortly. Also, how personal information is being processed, and with a view to ensuring that it's processed in a fair, lawful, and accountable manner. Then thirdly, basically is to regulate the practice and operations of data processing, essentially in Nigeria. What's the scope of application of the Act basically applies to how any a system, whether it's an automated system or not. So a lot of people say, I don't have computers, or I don't have this. It does not exclude such entities, organization from the Nigerian Data Protection Act. So it applies whether personal information is processed using an automated system or an ICT system or not, even if what you have is just shelves and shelf filing system in your facility or organization. Secondly, as long as you operate or reside in Nigeria, you are expected to align with the Act. Then also, even if your business or operations is not domiciled in Nigeria, where you are processing personal information of a data subject that resides in Nigeria, yes, the Act applies to you. Like I said earlier, so when we say data subject basically means an individual whom personal data information relates to. When we talk about personal data, it means any information that relates to an individual. It could be information that helps to identify the person, or even other things, and which is one of the reasons why we are bringing even health-related information. They are classified as what? Personal data. So whether it's physiological, whether it's psychological, and so on. So that informs the term personal data. And just like head of medical operations has mentioned earlier, in giving care to, we must consent to something that is also very important. When we talk about consent, consent means freely giving or permission or statement, that is agreement of an enrollee or an individual to the use or the processing of their personal data information for the purpose for which it is intended. And then when we talk about a data processor, so who is a data processor? It means an individual or an entity, that is an organization that processes personal data on behalf or at the direction of a data controller. And the data controller means an individual who carries out the scope or the process of acquiring data for the purpose of what processing it. So when we say to a lot, so you may be wondering, so how does it apply to me? How does it apply to me? So just to wrap that up, by virtue of the designation of how data controllers and processors have been classified according to the Nigerian Data Protection Act, a data controller processor is an entity organization that keeps or has access to a filing system of personal data for data storage. So as long as you are maintaining a system, whether automated, digital or not digital, for processing, acquiring or utilizing personal data information of a data subject, you fall into that category. And more importantly, certain sectors were classified, including financial, communication, and just for purpose of emphasis, the health sector, which we are playing within, is class. So if you are within, as operators within the health management industry, we are classified as data controllers and processors according to the categorization of the Nigerian Data Protection Act. Just to emphasize, in the course of how we engage and release, consent of data subject is something that we must always let them know, especially in case when you are referring them, because at that point in time you will be sharing their personal information, maybe with another party, maybe with another facility or something. So let them know that that their data and personal will be shared with those facilities for purpose of fulfilling the healthcare service that they are expected to get. So in summary, what our role or your role as a healthcare service provider, number one is to ensure that you are compliant with the Act vis-a-vis how we engage and the enrollees in terms of processing or using their personal data. Secondly is that we need to maintain and uphold the confidentiality in line with the executed service level agreement with Philips HMO. I believe all our providers are signed on, are onboarded in line with this confidentiality aspect. Number three is to ensure that personal information is used lawfully in line with consent that is obtained. Then finally, as healthcare providers or organizations and entities, we need to ensure that you are registered with the Nigerian Data Protection Commission and also comply as it relates to your business. If you need further information about how to ensure compliance or more information, or you need to do so, you can visit the NDPC website as shown on screen. That's www.ndpc.gov.ng. Thank you very much for your time. If you have any questions, like Anko has said, please, you can drop them in the chat box and then we'll respond to it accordingly. Thank you very much. Over to you, Margaret.
All right, thank you so much, Mr. Tommy. That presentation was quite insightful. I'm sure our providers now know what to do. As far as data is concerned, it is very important that we maintain confidentiality. Like I said earlier, these are people's medical histories, so it is important that their privacy is respected. All right, just to reiterate, I can see from the chat that a lot of people have indicated their phone numbers. Please ensure that this is submitted via the survey link. You know, it's not expected that the phone numbers are dropped on the chat box here. There's an allowance for it, there's a place for it that has been provided via the survey link. After you have taken the survey, if you go straight down before you submit, you will see where it says you should indicate your name, the name of the hospital or provider that you work with, of course, your phone number and the network that you use before you submit. So please, it is very, very important that you do that, because if you submit it via the chat here, we won't lift it up from here, because we would expect that it comes to us via the survey link. So if that has not been done, please do that right now. So far, we haven't gotten some responses. We have gotten some responses, but we need more responses, of course, so that you are assured of getting your data gifts. All right. If you drop your phone number here without completing the survey, you would not, or you may not be eligible to receive a data gift. So please go ahead and fill out the survey. All right, so this is also one of the key segments of this provider forum, which is largely the portal training. Of course, this is the portal that we use, that our providers make use of while either submitting their claims or giving access to our enrollees to access care, eligibility check, and all of that. So our claims manager in the person of Faith will be showing us how to go about all of these details. So please drop your questions if you have any inquiries, if you have any concerns. Our team is on standby to ensure that all of these questions are answered. Like I said again, please participate in the provider survey, drop your phone numbers so that you can get your data gifts. Thank you so much. All right, Faith, over to you, please.
Good afternoon, everyone. Good afternoon, everyone. My name is Faith, and I'll be taking you through the use of the portal for our claim submission. Thank you. Okay, so I believe we all have the knowledge of how to submit claims on the portal, and for this during this particular period, I will just be explaining 4 major aspects on the use of our portal. I'll be telling us how to check and release eligibility from the portal. I'll be reminding us on how to click on final submission. I'll be reminding us on how to get our payment advice from the portal, and also how to track our claims level on the portal. These are the 4 major things I would be explaining here in this session. So I'll go ahead to share my screen now. I'll go ahead to share my screen and okay, so please confirm you can see my screen. Okay. So the first one is how to check eligibility from the portal. So when you log on to your portal, okay, so when you log on to your portal, I'm trying to log on to my portal. So when you log on to your portal, when you go to PHMO.ng, it will bring you to this landing page. So all you need to do is to put in your username and then you put in your password. So once you do that, and I believe we all have our username and our password. So once you log into your portal, we have the home, the member, the authorization, claims, reports, and that's it. So for us to be able to know how to check eligibility of a release, all you need to do is to click on, sorry, let me log on to the portal to get my login details. Please, I'm trying to get my login details to log into the portal. Okay, so I come in here, I put in my login details as a username, and then I put in the password. Then I log in. So once you log in, you're going to say all member and the rest. But for now, I'll start with eligibility. And for you to check the eligibility, you click on home and then you put in the release number. So I'm going to be using a particular release number. So once you put that, you click on submit. And then it gives you all the details, the release number, the dependents, the full name, phone number, and everything you need. So for this particular encounter, it's the principal at the hospital. So you just click on view. It asks you, is this enrolling currently at the hospital? Click on yes. So once you click on yes, you scroll down. It tells you, okay, this lady is active and this enrollee is allowed to use this hospital. So with these two information, you've been able to confirm that the enrollee is active, and you've been able to confirm that the enrollee is allowed to use your hospital. So that is it about confirming eligibility of enrollees once they come into your facility. Now, the second thing I'll be talking about is final submission, because we've had instances where providers submit, upload claims on the portal, but they forget to click on final submission, and then they come reaching out to us, okay, we submitted our April bill, this is so month, and we are yet to get payments. And then by the time we go to the portal to check, we realize that, okay, fine, they've uploaded these bills quite all right, but they have not clicked on final submission. So I'll be putting us through that as well on how to go to that. So this is claims, primary claims, for example. So you put in the enrollees, you select the batch first. So I'll be taking it, I'll just take this particular batch for example. Okay, no, let me start from the beginning. The first thing you do when you come on to claims is to create a batch. So let's go ahead and create a batch for this bill submission. So this is December primary Philips tests. Bill. It's for the month of December 2024. So it's a batch. And I believe you all know that what a batch need is the month of that bill, the year of the bill, the type of the bill, is it not auto periods? And then, okay. Okay, so I said we all know what the batch needs. For you to create a batch, the provider's name, the month, the year, and the type of the bill. Is it primary or secondary? With that, I mean, is it no auto periods? So now that I've created the batch, you can see it's here, batch has been created successfully. So you just come here and select the batch I just created. Encounter dates. Let's use today, 12th of December. It's an outpatient case, so the same 12th of December. Now, diagnosis code, we all know how to get our diagnosis code as well. The portal does not accept you typing the diagnosis. It makes use of ICD-10 code, and I believe that we know that. Just go to your Google Chrome, type in malaria ICD-10, and then it gives you the code B54. So you come back to your portal, and then you put in B54. It gives you the case, and then you click on it. Procedure code, general consultation. Quantity is 1. Please let's always ensure we put in the right quantity. And then the price comes automatically. You put in your comments. Came in by red tick, and every other information you feel we would need to vet this particular bills appropriately. Then you click on add to list. Oh, okay, I forgot to put in my release ID number. Okay, so it has gone. So I'm just going to be using the general consult, but for the sake of the facility, definitely you're going to do more than general consults. There's going to be investigations, that's laboratory investigation. There's going to be drugs, injections, or every other thing. So once you're done putting everything, then you can now come and click to add to batch. Please click on add to batch only when you are done inputting everything for this particular enrollee. Okay, now let's assume I am done. Let's assume I am done with everything for this particular enrollee. So I just come here and click on final submission. This is it here. Because most providers forget to click on final submission and then they just believe that, okay, they've submitted their bills for the month. So I click on final submission and it tells me, please note that this submission is final and you will not be able to add any more claims to this batch. Are you sure you want to proceed? I click on yes. It's been submitted. So if you see, if you come back here now, you're not going to see that batch number again. The batch number I created because I've already submitted it. But assuming I didn't click on final submission, the batch number will still be showing here, just like all these ones are showing. This is because they've not been finally submitted. So that's about final submission. So I've talked about and release eligibility, final submission. Now let's go to payment advice, because we receive a lot of mails from providers asking for payment advice when you can easily get them from your portal. So to do that, you come to your reports, click on processed claims reports. And once you click on that, it's going to ask you to select some information. So what you do is you click on, for the month, I'll be using the month of July. For example, I put in my month, then for the year, I put in 2023 and choose one. Is it your primary, which is no odds, secondary, pre-odds? So for this, I'll be checking for no odds. It's going to ask you to select the batch number and I'm going to select this and I click on get data. So now if you look at the right hand side, you can see the claim summary. Claims count is 23. Now for you to get everything showing, just click on more details. So when you click on more details, you scroll down and then you see this is approved. If you click on the drop down, you will see approved and denied. Now for the approved, it's saying no data found, and this is because this bill has been vetted and everything was denied. That is why you can see nothing here. But assuming it's a normal provider, because this is a demo provider, it was created for the sake of training. Now, assuming it's a real provider, there will definitely be items under the approved. Now, let's go check the denied. So this is your payment advice. Once you click on go to reports, click on process claims reports and select the month, the year, and the type, and then come down to view. Now, if you look at the denied, you can see everything in the denied part. Total claims count here is 23. And if you come down, you'll see that the total denied is 23 as well, because nothing was approved. Now, if you want to check for your denial reasons, because the payment advice contains reasons for every amount that was cut down or every procedure that was denied, you will get the reasons from your payment advice. So let's check why this paracetamol was denied. So once you go towards your right, you will see denial reason. This is a column. You can see it's a procedure denied in case management. Now, this is the major reason for this, because like I said earlier, this is our demo provider. So there is no suitable reason for denying this than to say it was denied on case management, because there's nothing to approve and to pay for. So we use the particular denial reason for everything. But there are several other denial reasons you can see in the payment advice of a real-time provider. For example, you could see polypharmacy. Let's say, for example, for a case of malaria, we're seeing paracetamol, diclofenac, or phenadrine, and the likes. That's too many analgesics, so we tend to deny some and approve some. For that particular one, you can see polypharmacy, or you can see duplicates, like what paracetamol is what diclofenac could do as well for the case of that malaria. So why give both? So you can see several reasons. So when providers ask, so instead of reaching out, when you get your payment evidence that okay, your May bill has been paid, go to your portal, get your payment advice, go through the reasons of whatever amount was denied. So if you're not now okay with it, you can then reach out for a reconciliation. But you can always check your payment advice from your portal to get your full reports. Now that's about the payment advice. The fourth and the last I'll be talking about is the claims level. That's for you to be able to track your claims level on the portal. So that would also fall under this report. Remember, process claims report is for payment advice. Submitted claims report we'll be clicking on now to track your claims level on the portal. So I just did that now and it's loading. So far so good. We're able to reconfirm and teach ourselves again how to check and release eligibility from the portal, which is very, very important. Whenever an enrollee steps into your facility, the first thing you do on the portal is to check eligibility. It will take you nothing less than 30 seconds. Just put in the ID number and it tells you what you need to know. Then we've talked about final submission. It is one thing to upload and another to submit. If you upload and don't submit, we will not be able to work on it from our own end because it will keep telling us that the provider still wants to upload and has been submitted. Then we're able to talk about the payment advice as well, where you can check the reasons for your payments, every amount that was cut down, every process that was denied. And finally, now we're talking about how to track your claims level on the portal. So you can see now it has finally opened. So where you see one, you can see batch number, you can see the month, you can see the submission type, and you can see the claim stage. So you can search with whichever month you want to search for. Let's say I want to check the level of my, this is December, right? Okay, I want to check the level of my November bill, or my October, or my September, or June, or July. Just search with any month you want. So you can see when you see batching means that it's been submitted, but we've not worked on it. Level 2 is processing. When you see processing report, it means that we've already started work on the batch, on that particular batch. Then we have level 3. Level 3 is approval. It means that we are done vetting and we've sent for approval. That's level 3. Level 4 is batch for payment. Level 5 is awaiting payment, and then level 6 is paid. So once you see all those levels, it helps you to track your claims. Okay, I think they started working on it. Okay, it's awaiting payment. Okay, it tends to like this keep you in check of how your claims are being treated when you finally submit them to on the portal. So the first level, like I said again, is batching, has been submitted but not worked on. Level 2 is processing, means it's been worked on. Level 3 is approval. We are done vetting and has been sent for approval. The next batch for payment is being put together for payment. Awaiting payment means that it's been uploaded and then about to be paid. And finally, we have 6, which is paid. Okay, we also have level 0, nothing to pay. Let's assume you are duplicate and it just the system automatically denies all. So I think that's about tracking your claims level on the portal, and I believe I've done justice to the 4 major things. And also on this page, we have the YouTube link to the main claim submission training. Just in case you want to refresh your memory, you can get the YouTube link from the chat and then go through it in your leisure time. Thank you.
All right. Thank you so much, Faith, for that presentation. It was very detailed and very informative. I believe a lot of us here, a lot of the providers here have learned a lot of things from that presentation. I can see that so many people have reacted to it by asking that the presentation be shared via their email so that they could refer to it. Of course, like Faith has rightly said, there's also the YouTube link, which would definitely also show you some of these important details in a more granular form. That way you're able to go through it. Of course, this is also a presentation that is done once we onboard our providers. We put you through the portal training, give you access to the portal. So all of this is done at the point where you join, when you sign up with us as a provider. And of course, occasionally over time, we also insist on you learning these things and knowing these things because they would really help you in your partnership with us. All right, so I can see that a lot of questions have already been dropped via the chat. And but we'll go straight into the members on the call that have, that have questions. I'm sure a lot of our people are already responding to the questions that have been dropped via the chat. So please don't worry, you would have your questions answered. So we are now in a very key